My name is Tiffani Pritchett. I'm doing my portfolio project for my health assessment class for PSC's BSN program. My volunteer is Kim Nelson. Do you give consent to be recorded, for it to be posted on YouTube, and for my instructor to review our video?
I consent.
Okay, so I've chosen, here's my ID with my name and photo. And I've chosen assessment number 1, focusing on the heart and lungs. Our patient is a 24-year-old white female. Can you tell me your name and date of birth?
Kim Nelson, 2/15/1994.
Okay, and do you know where you are?
At my house.
And what are we doing?
A project for your school.
Okay, and who's the president?
Donald Trump.
Alright, my patient is alert and oriented ×4. She appears the stated age. Her level of consciousness is intact. Her skin color seems to be appropriate for age. Her posture and position is appropriate for the situation. No obvious physical deformities. We will get a little more in depth with that. I saw her walk in the room. Her gait was steady. Do you use a cane or a walker or anything of that nature?
No.
Okay, and what do you do for a living?
I'm a nurse.
And is that a stressful occupation?
Can be.
So what's your health history other than what we discussed earlier as far as migraines and the frenectomy?
I had a frenectomy and I do suffer from migraines.
Okay. Her facial expressions and mood seem to be appropriate for the situation. She doesn't seem to have any trouble hearing, talking, or articulating her speech. Her hygiene seems appropriate. Miss Nelson, how tall are you?
5'3".
And how much do you weigh?
180 pounds.
Okay, and at a later time we can calculate BMI and address that if needed. Before we started recording this video, we did the Snellen eye chart where Miss Nelson stood at the line, covered one eye, read the letters, did the same with the other eye, and it seemed to be appropriate 20/20 vision. You stated you do not wear glasses or contacts, correct? Okay, and we also did vital signs prior to recording this video. Her blood pressure was about 110/68. Her O2 saturation was 98% on room air. Her temperature was 98.6 degrees Fahrenheit. Her respiratory rate was 16 breaths per minute unlabored. All of that within normal limits. She did come in experiencing some intermittent shortness of breath, which is why we're here today doing this assessment. And you also stated you were not in any pain at this time, correct?
Correct.
Okay, so I'm just going to do a full assessment on you, focusing on your heart and lungs. Might be a little bit extensive just for purposes of this video, okay? So just bear with me. And if at any point you have any questions or any pain, stop me and let me know, okay?
Okay.
Alright, so first I want to look at your hands and your nails. Seem to be appropriate. Skin is pink, warm and dry. Her capillary refill is intact. No apparent lesions or anything abnormal there. Her skin temperature, moisture, texture, skin turgor is fine. All of that is appropriate for age and situation. Okay, so I'm just going to feel around, get a little personal with your scalp, and check some things out with your face and your arteries and things like that, okay? So her hair seems appropriate throughout. No scabs, bumps, scrapes, bruises, no anything abnormal noted in the hair. Her face seems appropriate structurally. Can you raise your eyebrows for me? Can you make balls in your cheeks? Can you stick your tongue out? And can you smile real big? Alright, that seems symmetrical. I'm just going to feel for your arteries right here. Okay, and open your jaw for me. Close, open again, and close. Any pain or discomfort there?
No.
Alright, any pain in your sinuses at all?
No.
Okay. Alright, and now let me find my pen light. We're just going to test your visual fields. You don't wear glasses or contacts. Any changes in your vision lately, blurry vision or anything like that?
No.
Alright, so I just want you to look at my nose. I'm just going to shine this light in your eyes, okay? Alright. Perla is present. I want you to follow my pen line. Alright, and I'm going to bring it towards you, follow it there, and back. Okay, so I'm going to put my hands behind you and come into your peripherals. Let me know when you see it, okay?
No.
Okay, and same thing on this side.
No.
Alright, and the external structures of the eyes seem appropriate. Eyelashes, eyebrows intact. The pupils and the iris seem appropriate color, shape, all of that seem pretty normal. If for simulation purposes, I'm going to pretend this is my ophthalmoscope. I would shine it in your eyes, look for red reflex, look at your optic disc, your vessels, your retina, the background of your retina, in both of your eyes. All of that I assume would be appropriate for simulation purposes. I'm also going to assess your ears. So externally, they look how they should. Any pain or bumps or bruises or anything back here?
No.
Alright, so I'm just going to lift the ear up and back. The tympanic membrane is gray and pearly, as well as that side. Okay, also for simulation purposes, I would have a tuning fork that we would do Weber tests with. How that works is we bang it on our hand and set it on top of your head, and you let us know if it sounds appropriate and equal in each side of your ears. But for simulation purposes, we're going to pretend that that is appropriate for your age as well. Also, we would bang on one side of your ear, put it behind your ear onto the bone. You would raise your hand when you couldn't hear it any longer. We would hold it in front of your ear. You would also raise your hand again. We would do that on each side. The time you can hear it in front of your ear versus putting it on the bone behind your ear should be about double in time. That is called the Ren test. The one on top of your head is called the Weber test. Alright, and I'm just going to shine my little light in your nose. Sorry. And have you ever been told you have a deviated septum? Any trouble breathing through your nose at all? Okay, take a big deep breath through your nose. Plug one side and do the same thing, in and out. Plug the next side, do the same thing, in and out. Alright, and I'm going to look one more time. The mucosa seems okay. Nasal hairs seem appropriate. Septum doesn't seem deviated. Nothing abnormal whatsoever. And just open your mouth. Don't say ah. I'm just going to take a look around. Mucosa are moist and pink. Stick your tongue out. Tongue looks good. Can you move your tongue around? Okay. Teeth are appropriate. Gums are appropriate, pink and moist. Stick your tongue out and say ah. The uvula vibrates. Lips are pink and appropriate. Alright, and I'm just gonna feel around on your neck a little bit. Again, getting a little up close and personal. If you feel any pain, let me know. Just kind of feeling for your lymph nodes here. And I'm assessing your carotid pulse. We do that one side at a time so we don't cut off the blood flow to your brain. Palpable on each side. I'm feeling on your trachea here. Can you swallow for me? Alright, great. And can you do that with your head? Range of motion is appropriate. Any pain with that at all?
Nope.
Alright. So now I'm going to ask you to turn around for me. Just going to make sure this is still recording. Alright. Okay, and I'm going to feel on your neck again a little. Just feeling for your thyroid gland. Lean your head to one side for me. And the other side. Alrighty. So I need you to just take a big deep breath for me. I'm just assessing for symmetry, making sure everything looks good and equal on each side when you breathe in and out. I'm going to take a look at your skin, trying to keep you covered as much as possible. No deformities skin-wise. Everything looks okay. Color is appropriate. and symmetrical, I'm going to do an assessment for tactile firmness. That is where when I put my hands on your back, I'm going to have you say 99 every time you hear my hands move. I'm feeling for vibrations when you talk, which is what we want. So go ahead and say 99.
99.
And one more time.
99.
And one more time.
99.
Alright, that sounds appropriate. And I'm just going to feel around for any lumps. If you feel any tenderness, please stop me. Any tenderness whatsoever?
No.
Okay, and lean your head forward for me. Alright. Spine feels good and symmetrical. No protrusions noted. So I'm just percussing over the lung fields, seeing if I hear any differences anywhere. And I do not, which is normal. I'm also going to do what we call percussion or CVA tenderness over your kidneys. So when I do this, let me know if you feel any pain, okay?
Okay.
Any pain?
No.
What about that side?
No.
Alrighty, and I'm just going to listen to your breath sounds real quick. Take a big deep breath every time I move my stethoscope. Alright, breath sounds are clear. Respiratory rhythm unlabored. No adventition sounds noted. Can you turn back around for me, Miss Nelson? Alright, take a big deep breath for me. Alright, and one more time. Alright, and I'm just going to take a look at your skin. Make sure nothing is abnormal up here. No lesions, bumps, scrapes, bruises, nothing of that nature. So I'm going to do the 99 test again. So go ahead, say 99.
99.
Okay.
99.
Okay.
99.
And one more.
99.
Alright, and I'm going to do percussion on this side as well. Skip over the breast tissue because that would dull my percussion sounds. Alright, and I'm going to listen up here as well. Deep breath. Deep breath. Deep breath. Alright. Everything sounds clear, normal, and no abnormal or adventition sounds noted. Can you squeeze my hands for me? Just going to test the range of motion in your arms. Okay, lift up against my hands and push down. Hold your arms straight out. To the side. Down. Up. Round and round. Okay? Alrighty. And just kind of hold my hand for me. I'm going to feel for your lymph nodes up here in your arms. We don't want to feel them. That would be an abnormal finding, and I do not. I'm also going to test your brachial pulse and your radial. I'm going to do those at the same time on each arm. Hold my hand again. Alright. And at this time I'm going to need you to lay down for me. And I'm just going to palpate your jugular veins a little. Make sure I don't feel or hear any bruise noted. Again, feeling each side by themselves. Feels normal. I'm going to take a listen with the bell of my stethoscope. Alright, and no bruise noted there. I'm just going to listen to your heart real quick now. I'm going to go in a C formation around the left side of your chest, okay? listen to your apical pulse for 1 minute. Alright, I've got 72 beats per minute. I'm just going to take another listen with the bell of my stethoscope in the same areas, just to get a little more fine-tuned auscultation. Alright, and I'm going to just feel for your apical impulse, just to see if we can feel your heart beating while we press. And I cannot, which is a normal finding. Alright, and again, so you're not really experiencing any shortness of breath at this time, correct?
Right.
Okay, so everything sounds normal. I don't hear any crackles or anything like that in your lungs. I know you had said previously you thought it might be anxiety related. No physical symptoms seem to be coming to light as far as what could be causing that, but I'll relay my findings to the doctor and we'll get a more extensive plan of care set for you, okay?
Great. Thanks.
Alrighty.